Good evening, you guys. Just getting everything pulled up here. Hi, Mila. Hi, Betty. Hi, Darcel. Thank you guys for joining me. We will go ahead and get started. Let me get my everything together. All right, so tonight we will be talking about the urinary system. So we're on part 6 for the body systems, and this is for CNAs and PCTs, but anyone can attend and review these questions with us. So we will go ahead and get started. Tana, I am well. How are you? All right, here we go. So we're going to do an overview of the urinary system. The urinary system includes the kidneys, ureters, bladder, and the urethra. Its main job is to remove waste and excess fluid from the body by producing and eliminating urine. The kidneys filter the blood, the ureters carry urine to the bladder, and the bladder stores it, and the urethra allows it to exit the body. Good to see you all as well. So why are we learning about the urinary system? So we want to detect problems early. You may be the first to notice changes in urine color, smell, or amount, and the important signs of infection or kidney issues. So we want to prevent infections. You guys know prevention is key. We want to do good hygiene, perineal care, and catheter care to help prevent urinary tract infections, also known as UTIs, especially in older or immobile patients. So we want to support fluid balance. Fluid balance is very important. So we want to monitor our eyes and nose, and that's our intake and our output, which is key to identifying dehydration or fluid overload. Then we want to have better reporting. So we want to understand the system, which helps us communicate clearly with nurses when problems arise and improving patient outcomes. I'm seeing more people come in. Good evening, Naomi. Hi, Miriam. Hi, Love Freeman. Veronica. All right, so we are going to get ready for the practice test. So you guys are about to take a short quiz on the structure and the function of the urinary system, common urinary problems like infections or retention, what action CNA should take based on patient observations, and also catheter care and hygiene basics. So as a tip, you want to read each question carefully and think like a CNA. What can you do to help the patient based on your training and your role? So keep that in mind whenever you're taking the test. I'll give you guys a few minutes or a few seconds to grab a pen, paper. Yes, everyone here will pass. That is very true. This is good energy, you guys. Keep it up and happy Monday. So I'll give you a few more seconds to grab something to write with, jot down your notes, and we're going to jump into the quiz. Here we go. Question number 1. Which of the following is a normal age-related change in the urinary system? A is increased bladder capacity. B is increased ability to concentrate urine. C is decreased kidney function. Or D, decreased risk of urinary tract infections. What do we think is correct here? Give you guys a few seconds. Yes, Mila, I am having a good day. Thank you. I'm seeing a lot of D's and C's. Have an A in there. All right. In 3, 2, 1 will reveal the answer. The correct answer is C, decreased kidney function. So with that, decreased kidney function is the rationale. As people age, kidney function naturally declines due to reduced nephron efficiency, which can impact waste filtration and fluid balance. So decreased kidney function is our correct answer there. Going on to number 2. Let's see. Gotta scroll up just 1 second, you guys. Okay, there we go. Couldn't see it for a minute. Thanks for hanging in there with me. So number 2, a nursing assistant is assisting a patient with stress incontinence. Which action is the most appropriate? A, encourage the patient to drink less water. B, restrict the patient's mobility to prevent accidents. C, advise the patient to wear a catheter at all times. Or D, instruct the patient to perform Kegel exercises. What are we doing here? I'll give you guys a few more seconds here. Good evening, Nicole and Catherine and Vanessa. Again, thank you guys for joining me this evening. All right, here we go in 3, 2, 1. The correct answer is D, instruct the patient to perform Kegel exercises. So the rationale, Kegel exercises strengthen the pelvic floor muscles, which can help improve bladder control in patients with stress incontinence. So if you guys aren't familiar with Kegel exercises are, you all can do them and no one will ever know that you're doing them. So one thing that you can do is that you kind of like pretend like you're going to urinate and you have the flow going, and then you try to squeeze those muscles really tight so that the urine stream stops. So squeeze real tight, and then you hold that for a few seconds and then you release. So when you're doing that, that's strengthening the pelvic floor, which can help you, like if you're having issues with incontinence, it'll help you retain that bladder so it's not leaking. So those are good to keep your pelvic floor toned. All right, next question. What is the best dietary recommendation for a patient with chronic kidney disease? A, low sodium, low sodium and low protein diet, B, high protein and high potassium diet. C, high dairy, high phosphorus diet. Or D, high sodium and high fluid intake. And Mila, with your comment, she says if you do it too much, it could cause urinary retention, so you want to be careful. So when we're doing those Kegels, we want to make sure that we're doing them to strengthen it. But if you have to use the restroom, it's important that you don't hold that in because that could be causing urinary retention. So what we're doing is to prevent incontinence and to help build up that pelvic floor muscle. All right, you guys, a few more seconds here. I'll give you 5 seconds and then we will reveal. All right, in 5, 4, 3, 2, 1. The correct answer is A, low sodium, low protein diet. So the rationale, a low sodium diet helps prevent fluid retention and hypertension, while a controlled protein intake reduces the workload on the kidneys. So the picture shows some examples that a patient can have with chronic kidney disease stage 4. So they can have fruits and veggies, low sodium iron items, plant proteins, high fiber foods, healthy fats, and then foods you enjoy. Whenever I say sodium, can you guys give me what that means like in layman's terms? So if I'm just talking to someone and I'm telling them to reduce their sodium, they're like, I don't have any sodium. What's that? What would you guys tell them? I'll be looking in the comments on that one. Just waiting on salt. Yes, good job, Tori. Great job. You guys are so smart and I appreciate the interactions. Yes, definitely salt intake. So, you have to make sure the way that you're communicating with someone that they're understanding it, because if I'm saying sodium all day and they have no idea what I'm saying, it's not making that connection with them. So yes, great job. All right, here we go. On to the next question. Which of the following is a primary cause of urinary tract infections in female patients? A, frequent hand washing. B, dehydration. C, a shorter urethra. Or D, consuming cranberry juice. What do we think for this one? So it's want to know the primary cause of UTIs in females. I'm seeing a lot of B's here. All right, in 3, 2, 1. All right, the correct answer is C, a shorter urethra. So the rationale, women are more prone to urinary tract infections because of their urethras are shorter, making it easier for bacteria to enter the bladder. So think of your urethra kind of as like a straw that's going up to the bladder. So if I have a straw that's this small compared to a male who has a longer urethra, which is this small, and we're having a race, the shorter one will get there first. So bacteria will do the same thing there. So that's making women more common for the urinary tract infections. All right, great job with that, you guys. Our next question, a patient is on dialysis. Which food should they avoid? It's A, apples and chicken, B, processed meats and bananas, C, white rice and green beans, or D, unsalted popcorn and berries. Give you guys a few more seconds on this one. And again, we're on question 5 here. All right. So the correct answer is B, processed meats and bananas. So the rationale, processed meats are high in sodium and phosphorus, while bananas contain high levels of potassium, which can be dangerous for a dialysis patient. All right, here we go on to number 6. Question 6. Let me make the question a little bigger for you guys. All right, the best position to place a male patient during a catheter insertion is A, supine with knees bent, B, sitting upright, C, side lying, or D, supine with the legs extended. Why is potassium dangerous for a dialysis patient? So, Mila, the reason that potassium is dangerous for a dialysis patient, so the patient's already in chronic kidney disease. You guys know your kidneys are your filtering mechanisms in the body. So they're trying to already get rid of the extra waste products and things, but they're having a hard time doing that when they're in kidney failure. So that waste product is just building up in their body. So then the potassium level is getting higher and higher because it's harder for it to filter that out. So if the potassium level continues to get high, that patient can die from that. So you may see somebody have to get immediate dialysis or emergency dialysis because their potassium level is too high. So always be mindful of your labs and different things like that. And if the patient is a dialysis patient, make sure that they're following the correct diet prescribed by the provider, because we don't want to cause any more issues to them. So great question with that. All right, you guys, let's go ahead and reveal this answer here. All right, the correct answer is D, supine with the legs extended. So the rationale is lying flat with legs extended allows for easier access to the urethral opening for catheter insertion in male patients. All right, next question here. Which of the following signs might indicate worsening renal failure? A, increased appetite, B, high urine output, C, swelling in the legs and feet, or D, low blood pressure? Give you guys a few seconds there. You guys are doing very good. I am proud of you guys. All right, here we go in 3, 2, 1. Swelling in the legs. C is the correct answer. Great job. So edema is a common symptom of worsening kidney failure due to fluid retention. So you guys know edema is the swelling, so swelling in the legs there. Great job. All right, next question. We're on question 8. So the best way for a CNA to assist a patient with functional incontinence. A, offer scheduled toiling assistance. B, encourage the use of bedpans only. C, place an indwelling catheter. Or D, limit fluid intake. All right. So we're on question 8, and it's asking the best way to assist a patient with functional incontinence. All right, here we go in 3, 2, and 1. The correct answer is A, offer scheduled toileting assistance. So the rationale, scheduled toileting can help patients with functional incontinence manage their urinary needs more effectively. All right, next question. Which electrolyte imbalance is common in end-stage renal disease? A, low potassium. B, high potassium. C, low sodium. Or D, high calcium. So we're asking about our electrolytes. Is this a tough one, you guys? All right, the answers are starting to come in now. Give you guys about 5 more seconds for this one. All right. Here we go. The correct answer is B, high potassium. So kidney failure often leads to hyperkalemia. There goes your prefix hyper, meaning high, which can cause dangerous cardiac arrhythmias. So high potassium can lead to death because it can cause the dangerous cardiac arrhythmia. So please be mindful of that. All right, next question here. A patient with nocturia should be advised to A, limit fluid intake throughout the day. B, drink plenty of fluids before bedtime. C, avoid daytime naps. Or D, reduce caffeine and alcohol consumption. I don't know about you guys, but for me, C would be tough. Avoiding daytime naps. I love a good daytime nap. All right, in 3, 2, 1. D, reduce caffeine and alcohol consumption. So caffeine and alcohol can irritate the bladder and increase urine production, worsening nocturia. So noc is night and urea is urine, so it means urinating at night. All right, here we go. Next question. We're on question 11. Why is perineal care important for patients with urinary incontinence? A, it prevents falls. B, it prevents urinary tract infections. C, it improves blood circulation. Or D, it reduces the need for adult briefs. I'm seeing a lot of people show up every week to this, so that is really good to have you all. And thank you guys for tuning in. Okay, here we go in 3, 2, 1. B, it prevents urinary tract infections. So that's the rationale says good perineal hygiene prevents bacterial growth and infections in patients with incontinence. So be sure to wipe front to back. What would happen if we wiped back to front? What do you guys think that will put us at risk for? Thank you, Mila. So let's think about this. So if we wipe from back to front, we have E. coli coming through the stool on the back end. So if we're wiping that from the back to the front, we're at high risk for a UTI, high risk for infection, bacteria going into the urethra, which we know women are more at risk for getting a UTI because that bacteria is just crawling up. So yes, for sure, spreading bacteria. So it's important that we as caregivers are wiping our patients from front to back, and then also that we teach our patients as well, be sure to wipe from front to back, because we don't want them to get a urinary tract infection or any kind of infection for that matter, but front to back always. Great job, you guys. All right, here we go. Question 12. What is an early sign of dehydration in elderly patients? A, high blood pressure, B, fever, C, increased appetite, or D, dark urine? All right, a few seconds here. And you guys did really good with that last question. Great job. You guys are very intelligent. All right, here we go in 3, 2, and 1. Dark urine. So if you selected D, great job. Dark urine, dark concentrated urine is an early indicator of dehydration. So in this photo, you can see from moving from left to right, it has this clear urine, then it's going to more amber, then it's dark, and then it's more concentrated. And this very last one here to the far right, that's an example of hematuria. So there's blood in that urine. That's why it has that pink tinge color. So the darker the urine, the more concentrated it is, which means that they're more than likely dehydrated because they're not filtering, or they're not getting enough fluid. That's why it's so concentrated. So the darker, the more concentrated it is. And does anybody know, like whenever, say you're emptying a bedside commode or something, you see that dark, smelly urine, you want to report that to the nurse. So I kind of gave it away for you what I was wanting to ask. So most of the time, dark, concentrated urine has a very foul smell because it's so concentrated. So it smells very strong. So be sure to report that to the nurse. All right, here we go. Question 13. What type of urinary incontinence is caused by sudden pressure on the bladder? A, urge incontinence, B, stress incontinence, C, overflow incontinence, or D, functional incontinence? All right, a few more seconds for this. See more answers coming through. Good job. Okay, in 3, 2, 1. Correct answer is stress incontinence. So with this one, the rationale is stress incontinence occurs when pressure on the bladder from coughing, sneezing, laughing, or exercising causes urine leakage. During pregnancy, the growing uterus increases abdominal pressure, which puts strain on the bladder and the pelvic floor muscles, contributing to stress incontinence. So sometimes, I don't know if you guys remember that commercial. It was, I believe, Detrol LA. It was in the early 2000s or late 90s. It was the gotta go, gotta go, gotta go right now. And that's because of stress incontinence. So if you sneeze sometimes and you're like, oh, I leaked a little bit, that's an example of stress incontinence. So great job with that. All right, next question. Question 14. Which condition is most commonly associated with the enlarged prostate? A, urinary retention, B, kidney failure, C, increased urine output, or D, urinary incontinence? What are we thinking here? All right, here we go with the answer in 3, 2, 1. Urinary retention. So, an enlarged prostate can obstruct urine flow, leading to difficulty emptying the bladder. So, the picture shows on the right, that's an enlarged prostate, and on the left is a normal prostate. And the prostate is usually about the size of a walnut. So, some issues that you may see with the enlarged prostate, it may be more difficult for the patient to empty their bladder. It may be more difficult to catheterize the patient. If you guys are working, if once you become a nurse, that's something that you'll be doing, is doing catheter. So if we have a male who has an enlarged prostate, the prostate is part of the urinary system, so it's right below the bladder. But if it's empty, or if it's restricting, if it's enlarged, it can restrict the flow. So do you see in the picture on the right hand side, it's showing how it's restricted through the area, so it's making it more difficult for that urine to come out. So if you're catheterizing a male patient who has an enlarged prostate, you may see that they need to use a Coude catheter. So with the Coude catheter, it's kind of like bent a little bit at the end like this, so it can go around the enlarged prostate. All right, there we go. Now we'll go to the next question. Question 15. A dialysis patient complains of extreme fatigue and nausea. What might be the cause? Option A, low blood sugar. B, fluid overload. C, high creatinine levels. Or D, high blood pressure. We're going to use our critical thinking skills for this one, you guys. I know you guys are very smart and you can think this one through. A few more seconds here. In 5, 4, 3, 2, 1. High creatinine levels. So option C, creatinine is a waste product that comes from normal muscle use. Healthy kidneys filter creatinine out of the blood and remove it through the urine. When the kidneys aren't working well, creatinine builds up in the blood, which can make a person feel sick or tired. As a CNA, it's important to report if your patient seems unusually weak, confused, or nauseated, as these could be signs of kidney problems. All right, question 16. Which intervention is best for a patient with urge incontinence? A, bladder training. B, limiting physical activity. C, decreasing fluid intake. Or D, wearing a diaper at all times. All right, we will reveal the answer in 3, 2, 1. Bladder training. So bladder training helps control sudden urges to urinate by gradually increasing the time between bathroom trips. So first, an example may be you go every 30 minutes as an attempt to see if you need to go, or you're taking the patient every 30 minutes. And then you're going to increase it to an hour the next time. And then you're going to increase it to an hour and a half, and then to 2 hours. So what you're doing is expanding that time. So giving the bladder more time to fill up. without having any accidents with that. So bladder training, that is what that is. All right. Question 17. Which urine characteristic is a possible indicator of a urinary tract infection? A, clear and odorless. B, pale yellow with no sediment. C, amber colored with no odor. Or D, cloudy with a strong odor. So we're looking for signs of infection. All right, you guys, here we go in 3, 2, 1. D, cloudy with a strong odor. So cloudy urine with a strong odor may indicate a bacterial infection in the urinary tract. So you guys see the picture of a, let's see, someone asked a question, but is it on? Give me 1 second and I'll answer that for you. So the cloudy urine with a strong odor may indicate a bacterial infection in the urinary tract. So that picture, it shows the cloudiness. So you can tell if urine is clear or cloudy by one, looking through it. If you put it on a flat surface, if you can see right through it, then it's clear. If it's difficult to see through, then you would consider that cloudy. Let's see. And then in the comment section, it says, but is it in all UTIs? Is it cloudy with a strong odor? Sometimes it may not be cloudy, but the cloudiness is a strong indicator that they may have that. So sometimes there's different characteristics of a urinary tract infection. Like a patient may, 1, have a fever. 2, they may have back pain. 3, they may have the cloudy urine with a strong odor. Sometimes it may not be cloudy. It may just have a strong odor. And every patient is different, but general characteristics is cloudy with a strong odor. So great question there. Yep, no problem. All right, you guys. Any more questions regarding the cloudy or the signs of a UTI or urinary tract infection? Okay. All right. Moving forward. We're on question 18. Which statement about urinary catheters is true? A, catheters eliminate the risk of urinary tract infections. B, catheters should be secured to prevent tugging. C, catheters should be changed daily to prevent infection. Or D, catheters do not require perineal care. All right, we'll reveal the answer in 3, 2, 1. The correct answer is B. Catheters should be secured to prevent tugging. So the rationale is securing the catheter reduces trauma to the urethra and prevents accidental dislodgement. So in the picture, that's an example of a catheter securing device. So you may see that on a patient's upper thigh because the catheter is coming out of the bladder. So it's a tube that's coming out of the bladder. So if we just leave it without being secured, it can tug. And when we as nurses, when we put the catheter in, we have to instill water into the balloon. Now that balloon is about 10 to 20 cc's. It depends on what the manufacturer says to put how much normal saline that we want to put in there or sterile water. So it's a balloon inside the bladder. So picture this is the bladder, this is the balloon. If you tug on that, that's going to come right out, or it's going to tug against the bladder, which you may notice. That's okay that you didn't read it properly. Just take your time reading your questions, you guys. But you guys are doing excellent. But if you notice that it's tugging on there, you may see blood or trauma to the urethra because of it tugging. So make sure that it is secured to prevent from tugging. So great job with that, you guys. All right, next question. We're on question 19. A patient on hemodialysis should be monitored closely for A, hypercalcemia, B, high blood sugar, C, hypotension, or D, increased urine output. All right, I will reveal the answer in 3, 2, 1. C, hypotension. So hemodialysis removes excess fluid from the body, which can lead to low blood pressure, so hypotension. So with that, you may see if a patient is on hemodialysis, they're in chronic kidney disease. So their kidneys aren't able to filter out the waste products. So they have to go to hemodialysis to have this done. So in the image that's in the slides here, we have a patient, they're hooked up to hemodialysis. So as you guys can see, the blood and the tubing, that's from the patient. So it goes into this dialyzer and it cleans the blood, and then it goes back into their body because they're unable to do this on their own. So if I had good kidney function, which I do, so I'm able to get rid of these waste products through my urine. So a person on hemodialysis, they're using the dialysis to remove the excess fluid from the body, which can lead to the low blood pressure, so hypotension. And that's okay that you guys changed your answer. So one thing that I do recommend whenever you guys are taking your test, be sure that when you select your answer, you only change your answer if it's a definite, if you can prove that the other answer is wrong once you select it. So take your time reading your questions and make sure you understand what the question's asking, and also you understand which each option is. But yes, be sure that you understand the question, you select the answer, and stick with your mind. Don't change your answer. And I can tell you, as a nurse who's been through nursing school, 9 times out of 10, when I changed my answer, I was right the first time, and I should have stuck with my gut. So that is that. All right, now we're on question 20. A CNA is caring for a patient with a condom catheter. What is the correct way to apply it? A, tape the catheter tightly around the penis. B, leave a space between the tip of the penis and the catheter. C, keep the drainage bag position above the bladder level. Or D, avoid changing the catheter unless it leaks. I see the answers are slowing down here. You guys are very smart. Just think this through. Think it through and we will get it. And the more that you guys continue to do these practice questions, the more familiar you'll be with the content, which we want you to be prepared. All right, guys, in 3, 2, 1. So B, leave a space between the tip of the penis and the catheter. So as a rationale, a small space, about 1 inch, prevents pressure injuries and allows proper drainage. And then over to the left, there is a free CNA skills video on YouTube to look at for placing a condom catheter on a male resident. All right, what is the main purpose of hemodialysis in patients with kidney failure? A, to help the patient produce more red blood cells. B, to increase bone strength and calcium levels. C, to improve lung function and oxygen levels. Or D, to remove waste products, toxins, and extra fluids from the body. few more seconds here. I hope you guys are enjoying the content tonight about the urinary system. And also, while enjoying, I hope that you guys are learning a lot from it. All right, in 3, 2, 1. The correct answer is D, to remove waste, toxins, and extra fluid from the body. So hemodialysis is a treatment used for patients whose kidneys are no longer able to clean the blood properly. The machine acts like an artificial kidney by filtering out waste products, toxins, and excess fluids that the body normally gets rid of through urine. This helps prevent complications like swelling, high blood pressure, and confusion. Let's see. Mila says, have you heard of hemolytic Mike syndrome? I have never heard of that myself. No, I have not, but thank you. I will look it up after this. Bianca says, at 30, is it too late to go back to nursing school? No, I don't think it's ever too late to do anything that that you feel passionate about doing. So as long as you're bringing the passion, the competence, and being a great nurse, I don't think it's ever too late. I don't think there's any age limit on it. Matter of fact, while I was in nursing school, I went to school with a lady. She was in her 60s, and she had just changed her career, and she ended up loving it. So never too late to do anything that you feel passionate about, and I encourage you to do it if that's what you're wanting to do. Hemolytic remix syndrome. Okay, I will look into that. Okay, all right, let's go on to the next question. Thinking the same thing. Avila, yes, if you're wanting to go back, I agree with you too. Definitely do it. This field needs plenty of caring, compassionate nurses. Yes, don't question it. Just go and be a great nurse. Yes, 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 and yes. All right, here we go. Question 22. A CNA notices a patient with a Foley catheter has no urine output for 4 hours. What should be the first action? A, remove the catheter immediately. B, increase the patient's oral fluids. C, check the catheter for kinks or blockage. Or D, call the provider for catheter replacement. So this question, it's important to know how to read a question, because if you read it properly, you can answer it properly. What is the first thing? This question is asking you, what is the first thing that you should do? Give you guys a few more seconds here. All right, you guys are answering this one very fast and very well. All right, let's see what we have here in 3, 2, 1. C, check for catheter kinks or blockages. So before assuming a serious issue, the CNA should check for simple problems like a kink or blocked catheter, which is a common reason for no urine output. So for example, think of it like a water hose. Like if you have a kinked water hose, nothing's going to come out of it. So what do? You unravel the water hose. So it would be the same thing with the catheter. If you notice like it's kinked in the bed, or it's not having a direct flow, or it's circled around something, just make sure the line is straight. It's going from the bag to the patient in a straight line. And then after that, if we have more concerns, then we're going to notify our nurse. I seen a question in the comments. Let me check that out one moment. Someone asks, what's after checks, call, or remove? So as a CNA in Illinois, I live in Illinois, a CNA cannot remove a catheter. And I believe that's throughout the United States and just grounds wide. That's not in a scope of practice for a CNA. So let's go back to the options here. So removing the catheter immediately, it wouldn't be the first action, but first we're going to do is check it for kinks or blockage. And then after that, you would be call, not the provider, you would go to the nurse, because remember, we have our chain of command is a CNA, next is the nurse, and then after that, you would follow whatever your proper chain of command is there. So yes, do not remove a catheter as a CNA, because that's not within a scope of practice, but you can check for kinks or blockages. And if you continue to have issues that with no output, you definitely want to notify your nurse. Okay. Any more questions on that? All right, let's go to the next one. Which of the following symptoms is most concerning in a patient with end-stage renal disease? A, increased thirst. B, itchy skin. C, frequent urination. Or D, sudden confusion. All right, revealing the answer in 5 seconds. So 5, 4, 3, 2, and 1. Sudden confusion. So confusion may indicate a dangerous electrolyte imbalance, such as high potassium levels, which can affect heart function. So we've been hitting this hard: potassium, potassium, potassium. So kidney disease, think they're at risk for high potassium. So we always want to notify the nurse if we have any doubt that there may be an issue there with the potassium level. All right. Next question is 24. Which of the following is a common cause of urinary tract infections in male patients? A, poor oral hygiene. B, high blood sugar levels. C, an enlarged prostate blocking urine flow. Or D, a high fiber diet. So remember, we're breaking our question now. We're reading our choices slowly to make sure that we're understanding them, and then we're selecting our answer. A few more seconds here. All right. In 3, 2, 1. C, enlarged prostate blocking urine flow. So in male patients, an enlarged prostate can press against the urethra and make it difficult to completely empty the bladder. When the urine stays in the bladder too long, bacteria can grow and cause a UTI. CNA should watch for signs like frequent urination, pain, or changes in urine color and report them to the nurse. Some other things that you could be looking for with the urinary tract infection, especially in the elderly, can be confusion. They may say that it burns whenever they urinate. They may be going constantly, like you may have just taken them to the restroom and they say, I have to go again. So that's the frequency. Things like that, just be sure to notify your nurse of that so that they can take the proper measures for that patient. All right, here we go, guys. Last question of the night. Why is E. coli commonly found in urine cultures of female patients with urinary tract infections? A, because E. coli is found in the air and enters through breathing. B, because women often drink less water than men. C, because women have stronger immune systems that trap bacteria in the urine. Or D, because E. coli from the digestive tract can easily spread to the urinary tract. What are we thinking here? All right, here we go with a drum roll for the last answer in 3, 2, and 1. The correct answer is D, because E. coli from the digestive tract can easily spread to the urinary tract. So E. coli is the bacteria normally found in the intestines. In females, the urethra is shorter and closer to the anus, making it easier for bacteria like E. coli to move from the rectal area to the urinary tract. This increases the risk of urinary tract infections, and CNAs should encourage proper perineal care by wiping from front to back to help prevent UTIs. So remember, we talked about that one already. So we said that we don't wipe back to front because that E. coli would come from the rectal area to the urinary area. It'll crawl up that urethra and they'll get a urinary tract infection. So we do not want that, and prevention is key. So always wipe from front to back there. Great job, you guys. And let's see. We have a bonus question. So, which of the following is a correct CNA responsibility when caring for a patient with a Foley, which is an indwelling catheter? A, changing the catheter if there is buildup near the meatus. B, flushing the catheter tubing if urine output is low. C, gently cleaning around the urinary meatus and catheter each shift. Or D, applying powder near the meatus to keep it dry. Lots of C's in the comment. I see Amelia and Rose, Yadira, Jesus, Betsy, and Mila, and Miranda, Miss Bonita. All right, you guys, a few more seconds here, and thank you so much for your participation. In 3, 2, and 1. C, gently cleaning around the urinary meatus and catheter each shift. So the urinary meatus is the external opening of the urethra where urine exits the body. So whenever you urinate, it's coming out of your urinary meatus. CNA should clean around the urinary meatus and catheter insertion site at least once per shift and as directed by the care plan. So be sure that you guys are reading that care plan. This helps prevent infection and maintain skin integrity. CNAs are not responsible for flushing or changing catheters, and powders can irritate the area or increase the risk of infection. So proper peri-care, making sure you're cleaning it at least once per shift, and gently cleaning around the area. And if they have a catheter, you guys know with proper catheter care that you're going to make sure that you're not tugging on the catheter when you're cleaning it. You're going to wipe straight down using the different area of the cloth or the peri wipe if you have one each time, and making sure that there's no discharge or anything on that. So we want to make sure that we're cleaning that up very well. Let's see, I'm reading in the comments. Avila, failed to write. This is why I gave up. Well, don't give up, Avila. If you feel like this is what your heart is set on doing, sometimes things don't come easy. You have to work hard for them, but in the end, the results are great. So definitely keep going, keep trying, use your resources. There's so many out there, and just find what works for you, but you'll get it. Just keep going. Don't give up. All right, so always remember, caring CNAs become caring nurses. And if you haven't done so already, go to the Florida Training Academy YouTube site and subscribe to our videos. Myself, Nurse Jackie, and also Nurse Eunice are so glad to have you guys. I know there's a lot going on during the week, and I appreciate you all starting yours off with me. Mila asks if we can do a CPR quiz next. Let's see, I will reach out and we'll see what kind of content we'll have for you guys, but we do always take your recommendations into consideration. So thank you guys so much for that. Let's see. So there we go again. So comment, like, share, and subscribe. And we have the website, www.fltraining.com. And thank you guys so much. I appreciate you guys tuning in with me. Somebody passed their exam on Friday, so congratulations for that. You guys are doing great, and I appreciate them. If there's no further questions, I will see you guys next week on Monday, I will be checking in with you guys and I will be presenting something for you all. So thank you much and good luck with everything. You guys have an amazing week and I'll see you next week.